In December of last year, the Royal College of Physicians and Surgeons of Canada, the certifying body for Canadian specialists, hosted a national summit to discuss changes to training that directly impacts general internal medicine. This unique event was in response to societal needs for general internal medicine. All ministries of health across the country were invited to participate. In recognition of its importance, Ontario and other provincial ministries of health were present, actively engaging and participating in the event. Prior to the summit, in my capacity as the R4 Program Director, I asked for a meeting with the Minister of Health to discuss the summit agenda and the plan for Newfoundland and Labrador. I called, I emailed, I called again, but unfortunately I was told that the Minister of Health was too busy at that time to meet with me. General internal medicine is the backbone of the hospital system, as Dr. Anwar said. As the Dean of Medicine, Dr. James Rourke, put it, general internal medicine does the heavy lifting in the healthcare system, and right now that load has become too much to bear. There simply are not enough general internal medicine specialists to provide the service required. As with hospitals in other parts of Newfoundland and Labrador, St. John City hospitals have unique challenges. There has been a migration into the Avalon region, and for this population, the Health Sciences Centre in St. Clair's are their local hospitals. In addition, these hospitals provide specialized services to the whole province. The demand for general internal medicine services has grown without the necessary increase in the number of general internal medicine specialists to provide care. Today we are releasing a review of general internal medicine services for the entire province of Newfoundland and Labrador, and it is included in the materials for you at this press conference. It is not long, but what it has to say is important. To put it simply, every single health board in Newfoundland and Labrador has identified general internal medicine as their largest and most significant problem area. Every single health board in Newfoundland and Labrador has identified general internal medicine as their #1 priority for immediate actions in the area of recruitment, retention, and physician remuneration. As the foundation of almost all the medical specialties and the backbone of the hospital system in this province, general internal medicine is fundamental and critical to the proper functioning of the hospital system and one of the most significant factors in the delivery of healthcare services to the people of this province. As the numbers of patients in our care continues to increase and the number of general internal medicine specialists decreases and ages, the likelihood of error grows. And no matter how hard we try, and no matter how good we are, and no matter how well-intentioned we are, we as physicians get to the point where we have to decide, do we continue the uphill fight to improve the situation? This is not a developing crisis, it's an existing crisis, and it has been years in the making. I and others have been raising our voices for the last decade, and it seems like no one is listening. And I want to thank you for listening today.
Thank you, Dr. Troy, and all the panelists for your clear explanation about internal medicine. And I hope it gives everyone here a flavor and understanding exactly what the job is. I'll open the floor now to any questions that you may have.